This topic is about nursing care procedures in a hospital. At the beginning, let's talk about eye care. First of all, you should understand that the eye is the most sensitive organ to which medication may be applied. And the cornea is especially sensitive, making the conjunctival sac the only appropriate site for instilling eye medications. Before all procedures that involve the use of medications, and also before instilling eye medications, you should perform hand hygiene, check room for additional precautions in regard to transmitting an infections, like using of the personal protective equipment, check allergy band or medical documentation for any allergies. Before the medication administration, including instilling eye medications, you should be aware and you should perform the 7 rites of medication administration. You should check that you have correct patient and confirm patient ID using 2 patient identifiers, for example, name and date of birth. You should check that you have the correct medication and that it is appropriate for the patient in the current context. You should also check the dose makes sense for the age, size, and condition of the patient. Different dosages may be indicated for different conditions. Check that the route is appropriate for patient's current condition. Adhere to the prescribed dose and schedule. Check that the patient is receiving the medication for the appropriate reason, and always verify unclear or inaccurate documentation prior to administering medication. And what about eye care itself? Apply single-use disposable sterile gloves in a manner which prevents the outer surface of the sterile gloves being touched by a non-sterile item. Use aseptic principle to ensure that only sterile single-use items are used to keep exposure of the susceptible site to a minimum. Using a sterile gauze swab, moisten slightly with normal saline, ask patient to look up and gently swab the lower lid from the nasal corner outwards once only. Likewise, using NU, slightly moistened sterile gauze swab, gently swab the upper lid by gently lifting the eyelid margin and asking patient to look down from the nasal corner outwards once only. Avoid touching the cornea for reducing risk of its damage. When you use eye drops, gently pull down the lower eyelid and ask the patient to look upwards. Instill the prescribed number of drops into the lower fornix. Ask patient to keep eye closed for as long as possible, preferably for 1 to 2 minutes. When you use eye ointment, hold the nozzle of the tube approximately 2.5 centimeters above the eye. Apply approximately 2.5 centimeters line of ointment to the inner edge of the lower lid from the nasal corner outwards. Oral care. Performing oral care, inspect whole the oral cavity, such as teeth, gums, mucosa, and tongue, with the aid of gauze-padded tongue depressor and torch. Take notes if you find any abnormalities like bleeding, swollen, ulcers, sores, etc. Place a face towel over the patient's chest or on the thigh with Macintosh. Put kidney tray in hand or assist the patient holding a kidney tray. Instruct the patient to brush teeth and clean tongue from inner to outer and avoid posterior direction. In case of unconscious patient, you should turn patient's head towards you, place patient in semi-Fowler's position. Oral airway can be used to hold mouth open. Use a small brush or swab to clean the mucous membranes and teeth. Use suctions to remove secretions and fluid. Use chapstick or lip moisturizer also. You should remember about the prevention of airway aspiration. Ear care. The procedure should be carried out seated, using either a headlight or head mirror and external light source. In this picture, you may see the irrigation of the meatus, and following irrigation, the meatus should be dried using cotton wool attached to the serrated or threaded end of the Jobson horn probe, a special probe for these purposes. Nose care. Secretions can usually be removed from the nose by having the patient blow into a soft tissue. Note the patient that harsh blowing causes pressure capable of injuring the eardrum, nasal mucosa, and even sensitive eye structures. If patient is not able to clean his nose, the specialist will assist using a saline moistened washcloth or cotton-tipped applicator. Do not insert the applicator beyond the cotton tip. Suctioning may be necessary if the secretions are excessive. When patients receive oxygen per nasal cannula or have a nasogastric tube, you should cleanse the nares every 8 hours. Use a cotton-tipped applicator moistened with saline. Secretions are likely to collect and dry around the tube. Therefore, you will need to cleanse the tube with soap and water. Skin care. For the face, neck, ears, skin care, put Macintosh and big towel under the patient's body from the head to shoulders. Place a face towel under the chin, which is also covered the top sheet. To prevent bottom sheet from making wet. Make a mitt with a sponge towel and moisten with plain water because soap irritates the eyes. Wash the patient's face, neck, and ears. Use soap on these areas only if the patient prefers. Rinse and dry carefully. Soap is particularly drying to the face skin. For washing upper extremities, Move the Macintosh and big towel to under the patient's far arm. Uncover the far arm, fold the sponge cloth and moisten. Wash the far arm with soap and rinse. And use long strokes, wrist to elbow, elbow to shoulder, and then to axilla. Washing the far side first prevents dripping bath water onto a clean area, and long strokes improve circulation, be facilitating venous return. Then dry by face towel. For washing the chest and abdomen, move the Macintosh and bath towel to under the upper trunk. Wash breath with the soap and rinse dry by the big towel covering. Move the bath towel covering the chest to abdomen. Fold the sponge cloth and moisten. Wash abdomen with the soap, rinse, and dry. After that, cover the trunk with the top sheet and remove the bath towel. You should understand that bath towel helps also to provide warmth and privacy during the procedure. For washing lower extremities, move the Macintosh and bath towel to under far leg. Put pillow or cushion under the bending knee. Cover the near leg with bath towel. Fold the sponge cloth and moisten. Wash with soap, rinse, and dry. Direction to wash from the foot joint to knee, from knee to hip joint. Repeat the same procedure on the near side of the leg, and cover the lower extremities with the top sheet. For washing back and buttocks, move the Macintosh and big towel under the trunk. Cover and back with big towel. Fold the towel and moisten, uncover the back. Wash with the soap and rinse. Dry with big towel, and remove the Macintosh and big towel. And the next today's topic is about bed making in a hospital. Linen is changed daily in intensive care unit and one or more times per week in an inpatient unit. Change linens also whenever they become wet or soiled. Linen is changed on the resident's bath day in a nursing facility. The bed is usually made in the morning. Linens are straightened during the day if they become loose or wrinkled. And you should check linen for dentures or other items. Before any bed making, you should make sure the wheels on the bed are locked before you begin to make the bed. And the position of the bed allows to change the linen. We can classify beds after bed making as closed bed and open bed. A closed bed is not being used. Top linens are not folded back, and the bed is ready for a new person, also used when the person is up for the day. And open bed is a bed that is being used. Top linens are folded back, so the person can get into bed. What are rules for bed making? First of all, use good body mechanics at all times. particularly if you deal with a lying patient. Hold patient or different loads close to your body to minimize the effect of their weight. To prevent twisting injuries, move your torso from your shoulders to your hip as one solid unit and avoid quick, jerky movements. Also, follow all standard precautions. Always wash your hands before handling clean linen and after handling dirty linen. Bring enough linen into the person's room. Always keep clean linen covered. Never shake linens. Do not take linen from one person's room to use on another person. Hold linens away from your uniform. Never put dirty linens on the floor or on top of clean linen. Roll dirty linen away from your body when removing it from the bed. The bottom linens must be tightly tucked without wrinkles. A cotton draw sheet must completely cover the plastic draw sheet. Straighten and tighten loose linen whenever necessary. Make one side of the bed completely before going to the other side. The large hem goes to the top of the bed. When you change the sheet for the lying patient, you should ask him or her to turn to one side, and then you fold the old sheet on the other side of the bed. After that, you straighten the new sheet on this side and ask patient to turn to this side and straighten the new sheet similarly on the first side. Collect linen in the following order: mattress pad, bottom sheet, draw sheet, top sheet, blanket, bedspread, and pillowcase. When dealing with unoccupied bed, raise the bed to a comfortable working height. Wash your hands before and after every patient contact. Gather all the equipment needed. Roll the soiled linen away from your body. Place the soiled linen in the linen bag or linen hamper, never on the floor. Return the bed to the lowest horizontal position when you are finished. To make a closed bed into an open bed, then fold the sheets to the foot of the bed. The smooth side of the hem faces the patient.